Thank you very much, Jeff. Thank you and good afternoon to everyone who's joining us today. I just start by apologizing for the lack of ASL interpreters today with the short notice. I'm afraid Heather and Sheila were booked up. About today's numbers, we have 455 new cases and unfortunately we're recording 2 more deaths. So I'd like to use this opportunity to send condolences to the families and also ask that we respect their privacy at this difficult time for them. In addition to the new cases we're reporting in the last 24 hours, if you go back to the period December 29th to January the 6th, the demand for testing in this province was really high. We were seeing increasing case counts. We had very broad testing criteria. And our capacity to deliver on those tests in-house was exceeded. We have a variety of contingency plans, and so these were activated as they had been in February of 2021. And we sent out 6,635 swabs over that period. Some of these have been reported, and that has added 680 cases from those 8 days to our case count. We still have 2,930 swabs not reported, and we are expecting those results within the next 24 to 48 hours. So again, you'll see an increment, but that is historical and reflects this period of high demand. Currently, the demand for testing is actually being met locally. And part of this is down to Dr. Fitzgerald's changes in her approach, public health's approach to testing. We are no longer testing the entire population, but we are looking at high-risk groups. And so I think we need to be conscious of that when we start to look at the numbers that you see. Because we're focusing on high-risk groups, it will have a tendency to skew the data. And some of the other indicators that we've looked at, such as percent positivity rates and these kind of things, on their own will be subject to some error because of that. This is all part and parcel really of our shift, our recognition that we're moving now from a pandemic phase of COVID-19 into an endemic phase where the disease, the virus will be amongst us, and Dr. Fitzgerald and public health recommendation is if you are not well, stay home. Only the people listed in the categories on the new testing criteria should avail of testing facilities. So it's just one metric. The metric I would draw your attention to today that is important is we have 4 people currently in hospital because of the severity of COVID-19. And that is a metric which the system can manage. Other issues that are topical at the moment, I'll touch on as well. In terms of vaccine and vaccine delivery, I think there's a little bit of confusion in some people's minds. We're advertising clinics as booster clinics. But quite frankly, if you're an individual who needs their first or second dose, then these clinics are for you too. You simply go and announce that it is a second dose or a first dose. And in the instance of Moderna, then there is an adjustment to the dose that you would receive. The instance of Pfizer, if you're in that age group, you get the same dose regardless. Boosters are not currently recommended for those under 18. It's only 18 and over. So 2 shots would be considered sufficient to provide immunity for those in the 12 to 17 group, and also for those in the 5 to 11 group. We do have some questions from parents in this very young group who had their first shot with the pediatric dose and have now crossed the threshold to age 12. They are eligible for an adult dose. The only difference between adults and children is the recommendation for the interval between dose 1 and dose 2 in children is 8 weeks, not the 28 days that it is for adults. On the vaccination front, there are plans being developed within each of the RHAs for home visits for those people who have an inability to leave their houses. And some of the clinics also will offer curbside. We will make sure where possible we advertise this up front, but I know, for example, at Waterford Valley High, when you check in the parking lot with security, you mention it to them, and that service is available, and it's available today till 8 p.m. So with that, I think the important thing is to realize that this sudden spike in numbers today is historical, and it represents events that have been and gone. And as our documentation processes ramp back up to normal, you'll see some adjustment in figures over the course of the next few days. As I say, there is another tranche of samples that were sent out that will come into the system over the next 48 hours. So with that, I think, Nancy, I'll pause and I'll hand it over to you to moderate the question and answer session. Thank you.
Thank you, Minister. Today we have 6 media joining us. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions today are from Sarah Smelly with the Canadian Press. Sarah, please go ahead.
Hi there. People want to know which metrics to watch in order to understand the impact of COVID-19 on our province. We were told percent positivity is one used by health officials, but the province is refusing to release that number and saying it's unreliable. What numbers should we be looking at?
I would suggest at the moment, the sensible one would be hospitalization numbers and ICU occupancy where relevant. Those are indicators of what we are concerned about as people responsible for the system. It is those that will provide the greatest challenge to the healthcare system. But there is no one. It's simply a matter of what element of COVID-19 interests you. And so there is a suite of things you can look at. And we endeavor to provide what we can in an open and transparent way and let people make their own conclusions. But as I say, it does require caution and it does require some thought in interpretation.
Thank you. I'm also wondering if you can give us an update on the situation in Labrador. Is Labrador considered a higher risk region, and what's happening with the efforts to vaccinate and test people in that region?
Labrador is a high prevalence region at the moment. It is certainly experiencing a wave that it has not seen before. As regards testing, there are regular deliveries of test kits into Goose Bay and then from Goose Bay across Labrador. And there's access to ID Now and Gene Expert locally. And indeed, I think there's a Gene Expert in Nain, for example. We're not hearing that testing capacity there has been exceeded. As far as boosters are concerned, as of close of business, I think on Saturday, there were 135,253 booster shots administered. Labrador figure, or Labrador Grenfell's figure for 3rd dose, the last one I saw, which was Thursday, I think, of last week, shows that 53% of eligible people have had a 3rd dose. So they are certainly ahead of some of the regional health authorities on the island and not behind any.
Thank you. Our next questions are from Peter Cowan with the CBC. Please go ahead.
Why wasn't the province upfront about the fact that we were sending these tests out and then there might be delays? I know there were a lot of people who have now spent more than a week waiting for results from these tests and had no idea that these sorts of delays were happening.
Well, I mean, obviously, I apologize for those people for whom it has been an excessive delay. From our point of view, it was always the case that we had contingency plans to send them out. I've answered questions about that in the past. And indeed, we'd done it before in February of 2021. I think we were not sure when these results would come. They arrived over the weekend and were put into the COVID tracker so people could access them through their portal. And here we are today explaining the situation. So I would argue that we've been open and transparent and as prompt as we could under the circumstances.
What is the bottleneck right now in terms of being able to do more testing? Is it not enough people, not enough equipment? Where is it?
I think the distribution of testing centers is regarded by some, particularly in rural areas, as challenging. We have empty slots for testing in some areas and not in others. We are now, with our change in emphasis on testing, focusing our testing capacity on those individuals, those areas where it will produce meaningful data to manage system impacts. And we will be using and have been using the rapid ID now as part and parcel of that. We have no awareness, there's no evidence to suggest that our current lab capacity is being taxed beyond what it can manage in terms of laboratory-based PCR, for example. So we haven't sent any out since the 6th of January.
Our next questions are from Brian Callahan with VOCM. Please go ahead, Brian.
Thank you. Minister, when you talk about moving into the endemic phase, what can you just elaborate on that? What does that look like and when do you estimate it'll happen?
I think it's a transition that's occurring already, and Dr. Fitzgerald and the Premier alluded to that on media availabilities recently. This is out there, it's very contagious. If you have symptoms, stay home. If you have somebody in the house who is COVID positive and you get symptoms, you've got it. The utility of the testing now is to monitor, to try and find new areas, to protect healthcare workers and essential personnel, and also to safeguard vulnerable people and the healthcare facilities and their capacity to deal with it. So I think this is all part and parcel of that shift. It was going to come at some stage. I mean, we'd acknowledged that as early as last year. Our plan was called Life with COVID. It's just that I think the realization may have been a bit late coming to some folk that this is where we would end up.
And how are you feeling, Minister? We know you've announced that you have COVID. Your voice sounds a little maybe Sudafeded. And I'm just wondering how you're feeling and you know, what experience has been like for you to be on the other side of this, and were you admitted to hospital?
The answer to the last question is no. I managed at home, and it's one of those COVID-related experiences I could really have done without. It was quite a miserable time, and you know, I feel a lot better. My voice, I think, is not Sudafed. It's down to talking a lot. This is the 4th Zoom meeting I've had in the last 3 hours.
Thank you.
Our next questions are from Peter Jackson with the Telegram. Peter, please go ahead.
Hi, nice to see you on the other side of that COVID.
Thank you.
Sarah mentioned positivity rates, and you said that you wanted to be transparent and let people see all the metrics, but I don't think you explained why you're not releasing those.
I think the daily positivity rate fluctuates because it has depended very much on, you know, where the testing clinics were and whether people were prepared to travel to go to them, because that has been a factor. And I mentioned that with the distribution piece. Now it's not going to be population representative because we are focusing our testing solely on high-risk individuals. So that rate will climb. I think to focus on any one particular number always has significant drawbacks. I mean, even my focus on hospital admissions, one could argue that that ignores the toll on sick time and isolation and these kind of things. So there is no one perfect measure now. So if you want a picture of what COVID is doing in the community, in the province, you have to go to various sources to do it. It needs some thought when you just jump on one number.
And you say that you have different testing criteria. The only one I'm aware of is that you're no longer testing people who are symptomatic or close contacts. Is that the only criteria you've left out? And if that is the case, wouldn't that increase the positivity rate?
Yes, it will. The other thing we're using now is that the rapid ID now, PCR, is being taken as confirmatory in certain circumstances. So these people would not have a lab-based PCR and would therefore not appear in figures here. These are done locally. The results are phoned and it's documented in a public health record in a different format.
Thank you.
Our next questions are from Renelle Legros with All Newfoundland and Labrador. Renelle, please go ahead.
I'm glad you're feeling well, Minister. I'm wondering, where were the samples sent for testing?
We had arrangements with the public health National Microbiological Laboratory in Winnipeg. So there was a group sent there. And we also had a company in the Greater Toronto area called Epitome Genetics. We also had a relationship with the Mayo Clinic, but we didn't actually need to use that one. We just used the other two.
Over 6,600 samples were sent out of the province for testing. Could that testing have happened here? I'm thinking of like Avalon Laboratories, for example, a local lab that does offer COVID testing. Could they have helped in this case, or perhaps in the future if needed?
We have an arrangement with Avalon Lab. Their capacity was exceeded too, so hence we had to activate our contingency plan.
Our next questions are from Jody Cook with NTV. Jody, please go ahead.
Hi there. Is there any further update on what might be happening with the distribution of rapid antigen tests coming from the federal government?
There are, certainly from our point of view, we have sent out kits to airports, which we'd agreed upon. There is work going on with the school district about a plan for reopening, maybe a test to start things. So some have gone to the school district. Some are being held as a kind of strategic reserve for community outbreaks. And there will be more detail about the release of rapid antigen kits that government, that the department feels should go out in the interests of public health. That's coming down the road.
Okay, an update on the VaxPass situation. I know a lot of people contacting us on social media over the weekend saying they still haven't seen an update to their actual pass since their booster. Should they expect to see that? Do they even need to have that updated? Where do we stand on that?
From the point of view of vaccine records, we're aware that there are somewhere of the order of around 25,000 booster or vaccination records that are still on paper over the holiday period. Those have yet to be entered. I'm not sure how many of them have been and how many are outstanding. And certainly that will slow their progress through COVID Tracker into the Healthy NL portal. So there is a delay, and that reflects, I think, some of the IT and clerical challenges over the holiday period during a surge as well.
I will now go back through each reporter to see if you have one final question. Sarah Spelly with the Canadian Press, do you have a final question?
Yes, I'm just wondering, you know, we are reporting deaths, and as we do this, our hospitalization number doesn't go up or down. I'm wondering if you can give us any more information. Are these people in hospital while they're dying? What's happening there?
I think one of our challenges is that while we have had, I think, 23 deaths now, unfortunately, from COVID, at any given moment, the number of cases has been such that to give much more in the way of detail risks breaching privacy laws. And so we have been very cautious about that. My understanding is that the last two individuals, for example, did pass away whilst in a healthcare facility. But I think we have been very careful to protect the family's privacy. Quite rightly so.
Peter Cowan with the CBC. Do you have a final question?
Minister, what's the benchmark that we're looking at in terms of the amount of time it'll take for testing? Where is it right now, and where should it be in terms of how long will it take you to get that appointment for a swab? And then what's the turnaround time for getting that swab and getting a result back?
We are down to 48 hours for call to appointment, and that's fairly consistent. Obviously, we would be happy with shorter than longer. In terms of laboratory time, our turnaround time in the laboratory prior to this last surge was running around 7.5 to 8 hours. It is currently around the 23-hour mark. And then once that's done and validated, it should appear on the portal. The delays, I think, here have been occasioned by the fact that these 680 results only arrived in the province on the weekend. And so that's why those people who have had what is an unfortunate delay.
Brian Callahan with VOCM, do you have a final question?
Yes, thanks. Where is Public Health Minister on drug therapies? And would they not contribute or help to reduce hospitalizations if they were administered early enough in the infection stage?
Public health's role would not necessarily involve drug therapy. That would be infectious diseases, and we've had certainly discussions with our federal counterpart to make sure that we have access to any national stockpile of these medications. There has, however, been no clear consensus about the utility of some of these drugs in a kind of preventative or anticipatory role for mild cases, for example. Certainly there have been studies in ICU settings, but my information from the health authorities is that we've not had any patients in that situation since these drugs became available. So that's a matter for clinical decision and clinical practice. And I'm probably not the best person to answer that. And I don't actually believe Dr. Fitzgerald would disagree with the fact that she's not either. I would direct you elsewhere. An infectious diseases specialist might be a better person to pose that question to.
Very good, thanks.
Our next question is from Peter Jackson. Do you have a final question today?
I do, thanks. I believe you said that there were quite a few other tests also out of province that you were waiting results on. Is this going to, have you been given any explanation for the delay? Are we going to see more people with results being delayed a week or more?
We're expecting the last group to be in within the next 48 hours. The group is, there's 2,930 swab results still pending. We believe that we understand that we will have all of these results within 48 hours.
Thank you.
Ronelle Legros with All Newfoundland and Labrador. Do you have a final question?
Yes, just to follow up to my last question, Minister, and perhaps just for my own clarification, I'm wondering if you have any agreements in place with any other local labs like the one that you have with Avalon Labs.
Avalon Lab is the only one we're aware of that is accredited and licensed to produce confirmatory PCR, lab-based PCR results. So they're the only laboratory that we've been using locally.
Jody Cook with NTV. Do you have a final question?
Yeah, and also just to further to my final question in the previous round, on rapid antigen tests, would you be using those to mandate kids to be tested before returning to class?
That discussion is taking place between education and public health. Education will come up with a proposal, and public health will provide some input on the back of that. What is known about rapid antigen tests is that they are less accurate. They are best used in symptomatic individuals, and their best effect is when they're used repeatedly over time. So you do one a day for 5 days, which has been what Dr. Fitzgerald has asked for travelers, for example.
Thank you, everyone. Minister, do you have any final comments today?
Yes, thank you for attending at short notice. I appreciate the effort. From our point of view, I think it was really important to provide some explanation around what had happened with our contingency plan and why there was a sudden jump in numbers. I hope that today has been informative, and thank you very much.
Thank you, Minister. Thank you, everyone, for joining us today. Please stay safe and enjoy the rest of your day.